Thank you, Dan. Is he going to be fired next week? I don't know. That's good. Yeah, we did talk about it. In fact, the early days of Lean, in looking at what we were doing, in walking the Gemba, in talking to the people back in Saskatchewan, based on an experience that I had one week in Seattle at Virginia Mason, my chief financial officer said to me as I was in the position of CEO, he said, "You realize that the change you're embarking on, you're going to lose your job." And apparently now that I'm deputy of education, he was right. It's been quite a journey. And I have to say, I phoned my mother the other day, and she said, "Where are you going?" I said, "I'm going to England. I'm speaking to the best of the best." There's a room of people highly dedicated to efficiency, highly dedicated to service, to those they serve. And as a bureaucrat, it's a dream to be able to present to you on efficiency. Every bureaucrat wishes they could come before such a group and talk about efficiency. God knows government needs it, right? We need help. We need help in what we do. We need to refocus. And we may not have a profit motive, but I can tell you we have a motive. And what my job is to unleash the potential in people. So the potential we're talking about is that you get their head in terms of targets and timeframes and managing to make the improvements, but what we're after is their heart. Their heart in terms of the changes and the fundamental reason why we do what we do, why you do what you do. So I just want to say, Dan, I appreciate this opportunity to speak. I appreciate this opportunity to present. And I think I'm the first bureaucrat on the universe who's been able to talk about efficiency. So maybe I'll lose my job, I don't know, but it'll only be because my job is waste. So we'll work it through. I wanted to share with you a bit of our journey. You have in England and throughout your various countries the democratic process, question time, question period. Right now, as we speak, our question period, or question time is happening in our legislative house, our parliament. And 90% of the questions that are being posed to the government have to do with Lean. It's kind of an interesting thing. We could be talking about all kinds of things, about the challenges and about social issues, but Lean is it. It's number one. And in fact, if you were in Saskatchewan, you'd say it's trending. It's trending because there are a lot of questions about the scale and scope of what we're doing. To give you a sense of it, it's only 1 million people. But in the health sector, we have 43,000 people who we're trying to work with, to encourage, and to motivate a change in culture. In the education sector that I'm now part of, we have 23,000 people. And to touch that many people, in terms of a province of just over 1 million, we're well on our way to training and to orienting an entire province in terms of continuous quality improvement. You don't do that kind of scale of change without getting a few people's attention. And yes, it is a grand experiment, but the experiment is this: if we can continue to keep our focus on those we serve, if we can continue to keep our focus in terms of their engagement, if we can motivate those in the know, those on the ground, those day-to-day, those people on the Gemba who day-to-day know their business, and rather than become and continue the bureaucratic approach that we have, which is largely top-down, if I can motivate 65,000 people in education and health alone by simply asking questions why, we're well on our way to creating the kind of learning organization that's necessary to carry us into the future. So I get a sense, and this is coming from a bureaucrat, I think that the internet is here to stay. Okay, I've declared it. So the key here is that the world has changed. We're motivated in different ways, and I suppose you could look at each of us and say it's the children we've raised. They have a greater expectation now, and it's our fault, but it's also our success, that what they expect out of the workplace is to be engaged. As a consumer, they have a position and a place where they wish to be part of the solutions, not to be passive, not to sit back and wait for somebody else in some corporate room to come up with solutions. And I think what we've got is we're well on our way to being able to engage those who are recipients of our service in terms of the improvement. So here's our problem. Well, maybe I'll share my problem with you. Lean is a difficult word. And the reason it's difficult is in North America, particularly in Canada, it goes to a place that is all about efficiency. Now, as practitioners, you know better. This is not about efficiency per se, although there are very important improvements that come about and cost savings, which I would suggest are a byproduct of quality. So what happens many times with our endeavors, and this is large-scale change, many times with our endeavors we talk certain words and we get to the mind, targets, timeframes, improvements, efficiency. And while that may motivate many of us, it's the heart. So I would much rather talk about, instead of the word lean, talk about hope, talk about engagement, talk about unleashing the potential in people, talk about patient first or student first, talk about those we serve and what we can do in terms of understanding what their true needs are. Start to put ourselves in a different place. And you see, we have a great advantage in the service sector over the manufacturing sector. The greatest advantage is our customer is right there. So many times what we've found, particularly in the health sector, where we started, is that we would talk about the customer in a way, in effect, they probably were right there, and we're talking about them as if they're not there. We have this great ability to engage because they're right there. They're experiencing the service, they're living the value stream, they're going from beginning to end. And I found what was really intriguing about this is I found that it was the bureaucrat or the CEO or the manager who got ill, who all of a sudden had an awakening because they became the client, the patient, the customer. And all of a sudden they experienced the value stream for what it was. My experience with Lean as a CEO was it was the first time I'd actually experienced the service. It was one of the few times where I actually went to the floor and lived it. Before that, I thought I knew it, and the briefing notes were interesting, the statistics were interesting, but the Gemba is where the truth is. So the manager I mentioned to you that said, Dan, you do this, you realize you're going to lose your job, I spoke with just about 3 months ago. And I said, so what do you think? He said to me, I think you're still going to lose your job, but I got to tell you this. When we have a problem today in our environment, we go to the Gemba. I thought that simple step of walking from your corporate office, from the boardroom, to the floor, to understand the nature of the problem by asking why is a huge leap. That's the leap of the future. Not high tech. It's not a new software program, nor is it a new or somehow an exception to management principles. It's actually going to where truth is, going to the Gemba, trying to understand the true nature of the problem, and for all of us being problem seekers and problem solvers. So let's talk a little bit about how we get to the heart. I want to tell you that the Saskatchewan experiment is on a scale. I have this privilege of serving. I think I'm one of the few. I made this title up, by the way. They told me, by the way, we'd like you to take on education. I know you're a health guy, but we'd like you to take on the education sector. So that's grade preschool, all the way through to grade 12. So I've got primary, secondary education as a responsibility. And I said, I'd be pleased to do that, but I've got one condition. I didn't know if I could say a condition, but I did it anyway. And I said, I'd like to be the deputy minister responsible for lean. And they actually gave me that title. So I think I'm one of the few deputy ministers responsible for lean. What does it mean? We're just making it up. It's a great title. What it actually allows me to do is nose in on everything across government to see how improvement is working. So I can tell you that what we've done in terms of the Saskatchewan experiment is I started in health, I moved it into education, and we moved it into and across every single government sector. Now, are we new at it? Absolutely. Are we learning? Yes. Are we making mistakes? Just watch our question period. Lots of mistakes, lots of steps, missteps. Are we failing? Yeah, we're failing fast. Are we succeeding? Absolutely. So what we've managed to do, and I'll give you some sense of this, is take a value stream from a particular silo and service like health, and we're walking through in a multi-ministry way all the touch points that occur. The potential of this is massive because the value stream that we see now is a very complex individual whose touch points are across social services, across health. They're encountering issues with police, corrections, justice. They're encountering situations where the family needs support. So when we see a student today that's missing school, I can tell you that one step is to intervene. The other step is to understand that all of the touch points are an opportunity to be able to provide a far greater intervention and support to that family in the context of their community, in the context of where they're from, on the context of the Gemba that they live in. So a little bit of Saskatchewan. For those of you that aren't aware, we're in Canada. We are a very plain, in terms of design, province. You can see that in terms of our organization, we really have a multitude of health regions. And the reason we do this isn't because of population, it's because of landmass. So you could literally fit the British Isle in 3 times over into our province. Great landmass. In fact, half of our province, there's 100,000 lakes, and there are about 30,000 people. So if you're interested in relocating somewhere, I can tell you that we'll give you 3 lakes. I've actually canoed up there. So we go on trips and canoe in the 3 weeks that are, there's no ice, right? And to canoe and find that you haven't run into a person for about a week is an amazing thing. I'll tell you that it's a relief to find civilization at the end of a week. The context of public service renewal is we, like every other government, are going through this phase of trying to understand who we are, what we're about, and focus in on the citizen. This is important. We don't have a profit motive. So what is our motive? Our motive is to better serve the individuals. Do we have all of the experience of a bureaucracy that you might encounter? Absolutely. All of the above. The systems, the processes, the band-aids that have been layered on over the years. That's the reason why this is the right time to be able to make those improvements. So the compelling vision is really around the citizen. How can we better serve? What can we do better in terms of our delivery? And it's not lost on anyone in this room. The fundamental question is, should we be doing anything at all? So as a government, you got to start with the question of why are we in any business, right? Why are we delivering on something that others might be in a better position to deliver on? So we are very much focused in on what we do best and what we shouldn't be doing so that others can take that space. A sense of urgency, we've got growth. And in fact, right now we have a situation where our unemployment rate, we have a difficulty finding people to fill our economic growth. We've got one of the lowest unemployment rates in the entire country. Seems like a strange situation, but I share this with you because many locales talk about a sense of urgency for change. We don't have that economic sense of urgency. So rather than a crisis economically, what we're talking about is a compelling vision to be able to move and improve the services that we deliver. The benefits, you know. And as lean practitioners, you understand that these benefits to your customers are always there front and center. For us, the very act of naming who your customer is and understanding what the root of the problem is a major leap. You can imagine a group of bureaucrats trying to get together and say, who's the customer? It's almost like a bit of distasteful discourse as they talk about this in terms that try to get to who it is that they're there to serve. What I've said to the bureaucracy, if you can't identify your customer, you're in big trouble. If you can't understand who you're delivering your service or product to, we've got a bigger issue. And the bigger issue is there's a tendency for the bureaucracy and for government services to be kind of self-perpetuating. We're there because we're there. We deliver because we deliver. And we layer on levels and layers and solutions from the top down that don't work for many people. How do you get thousands of people engaged to the point that they're actually motivated to each and every day come up with those Kaizen improvements? That's really the work that we're undertaking. So I want to give you a sense from two perspectives, short videos, from the student perspective and from the patient's perspective of what we're trying to accomplish. Let's see if this works.
The way we were doing school wasn't working for our kids, and so we couldn't ask our kids to change to conform to what we were doing. We need to change how we do school in many cases.
We spent a lot of time over the last few months talking to students, finding out what's important to them, what type of things would work best for them to learn. They talked about technology, they talked about teaching things, and they also talked a lot about the school itself.
I am ready to learn.
We're young, we know we're creative, we know what we want in a school because I guess we're the ones that are going to be in there.
Well, the first thing we want to do is really get the voice of the student in the conversation.
I'm respected.
I think our influence is getting through.
Education's becoming more and more student-led,
directed. Not that teachers aren't important anymore, but what we provide is different. We need to hear what they need and what they want, and I think we need to give kids more credit for what they're able to do and how they're able to direct their own learning.
I am engaged.
Well, it's pretty cool to be like adding my ideas as a student. They're doing a good job of listening to us and putting us first and hearing what we have to say about our ideas.
Lots of the times the teachers actually do get caught up in the curriculum. They start focusing on why are we building this school so we get the right amount of curricular space, when really they should be focusing on how does this space affect our students.
I can achieve.
There's more of a buy-in. I think they feel that they're part of the school. They feel that what they have to tell us as staff, that it's actually being heard and that this is their place. And our whole goal behind this was to make kids want to come to school and not that they have to come to school. We want them to be here. We want them to come every day and be successful in our building.
I am prepared for my future.
When you design it, you're designing a future for more kids instead of just designing their education. You design their future success.
Is really our launch of Lean. And what you see here are clips of students, not prompted. There are a few clips that are a bit of a prompting where you see the white background, but the children who are actually talking to this approach are actually designing the schools in Saskatchewan. So we have 6 warehouses right now, and Dan spoke to this with respect to our 3P design. This happens to be a warehouse where we've cut out in cardboard and styrofoam 18 schools. And these students, their teachers, have been involved in the design of these schools. The walls are less rigid. The concepts, and in fact, fundamentally, it's not really about the building as much as it is, as the students have conveyed, about the approach, the program, the future. These students, to a large extent, have been somewhere between grade 6 to grade 8. What would that be? Probably 12 years old, 12, 13, maybe 11 years old. And I can tell you that they had some fundamental ideas that have shifted the design and the concept of what the school of the future looks like. When we got bogged down, and the adults in the room got bogged down a lot through this design, what was happening is as they get bogged down, they'd turn to the students and ask them what they thought. And you know, this isn't a huge leap in terms of a concept. You're thinking, well, what else would you do? But the customer is right there. And these students had insights, and out of the mouth of babes, had concepts and ideas and input that really reflect well on our education system. We should have given them credit, course credit, for attending and for intervening and participating in this work. So what about the patient side? I mentioned we have 6 warehouses. One of them is the design of the school. And my vision, our vision, is that no school should be designed without a teacher, student actually walking through it in advance. So this thing is mocked up to scale. At least the classroom is, where they can walk in, they can take a look at it, they can improve it so that the next school we build will be even better than the previous. So let's talk about patients. Every improvement team in Saskatchewan in healthcare has a patient embedded on the improvement team. This move, while fairly straightforward from your perspective, engage the customer, is a big leap for the public service. And I can tell you that that leap fundamentally takes us to a new place. We all in healthcare think we know what the patient needs. There's an amazing impact of having the patient right there. It changes the discourse, it changes not only provides the perspective, but we behave differently as a group. And that behavior isn't about waxing philosophical about what the patient needs, because the patient is right there. So I want to show you what they have to say.
The whole concept of how to develop a healthcare facility where you're inviting the community to come in and participate. I've never heard of that till now, and I'll never forget this, ever. I'm thinking to myself, to my grandchildren 10 years down the line, if they're coming through, I helped do that over there. I put the models together, you know, and it's always going to be here with me.
I'm a cancer patient. I've been receiving treatment for 3 years, so I'm really understanding this now from the patient's perspective. It's so obvious to me that we need to change a lot of how our care is delivered to patients. So I get to share my experience with these people who are planning change, and I think it's really vital to hear from patients.
I look forward to participating in more. My involvement as a whole has been invaluable to me. If I could leave you with something from me today, please let it be this. I believe. I believe in the work that we are doing, in the lean process, and I believe in everyone's ability to pioneer change. With remaining open-minded, working hard, and maintaining our focus and vision, we'll be able to provide our city and province with the health care it's asking for. It will not be easy, and it won't even be hard. It will be defeating and at times hopeless, but so rewarding and so worthwhile. So I want to thank you for your time today, but most of all, thank you for everything that you do and your team members day in and day out, because it is making a big difference.
So you can go into the technical of what we're trying to do, but don't forget, we're trying to attack a societal issue, which is a matter of engagement. This is a movement, not just simply a series of tools or techniques. This is about changing up a culture. It's about empowerment. It's about looking at the art of the possible through the eyes of those we serve and those that serve them. Lean as a word really does us no favors. It is kind of it appears technical. It appears that someone's doing something to you. It's appearing that it's really about efficiency when the cost savings are really a byproduct of putting quality first. And we have proven, without a doubt, that you can improve quality, you can improve service, you can improve outcomes, and you can save dollars all at the same time. Employee engagement is really critical, and you know this well in your areas. One of the things that I'm starting to reframe is the question that we ask employees. And in part, change and large-scale change really is a function of not only looking at it from 50,000 feet, but looking at it also from the individual's perspective. To be able to attack what it is that we're trying to achieve, creating that line of sight, creating that shared vision. But with employees, fundamentally it comes down to this. What does a good day look like? And if you can define that, why couldn't every day be a great day? Now, the beauty of that question is that 95% of what a great day looks like delights the customer. We are able to speak to the heart. We're able to speak and hear from those we engage firsthand. What is it in your day that is that pebble in your shoe, that agitation? What would it be that we could focus in on today? A small incremental change, put it through a scientific PDCA approach. What is it that we could do that makes sure that tomorrow is better than today? That looks at what we know and what we learn, and trials and tests, experiments. Our problem, by the way, is not failure. In government, our difficulty is we don't fail fast enough. We will ride that dead horse forever. And the difficulty is we'll never call it for what it is. It's not working. Let's try something different. So what I'm encouraging is not trying to get a situation where we're failing constantly, but I got to tell you that one of the things that we are striving for is to fail more quickly so that we can go on and remediate and learn.
My name is Tom Stewart. I'm a registered nurse and I work as a Kaizen specialist in the Regina-Capella Health Region. I spent over 6 years working as an emerge nurse at both the Pasqua and Regina General Hospital. Working in emergency is challenging, and I often felt I wasn't able to give the care I wanted to, that I trained for, because our system made it hard for patients and for staff. Every day I encountered problems I felt powerless to change. While working at the General Emerge, I had a chance to be part of Releasing Time to Care, my first exposure to lean or quality improvement work. One of the things that amazed me was that my opinion as frontline staff mattered, and my voice was heard. I joined the Kaizen work for 2 reasons. Number 1, because the focus is always on the patient. And number 2, Lean believes the people with the best ideas for change are the people who do the work every day. Since starting, I've had the chance to work with both patients and nurses, using their ideas to make positive change.
I'll click through these slides fairly quickly, but we know the benefits to employee engagement, to revitalizing, to re-engaging, to unleashing that passion. I heard from a few civil servants as we were working through some of our improvement endeavors, and they said, I've returned, I'm back. I had lost my way over the years. I had maybe disconnected, maybe not been the civil servant that I had hoped to be, but I'm back. And the reason I'm back is because I've got a new focus, a renewed spirit, a new need to be able to make the kind of concentrated improvements. I'm engaged. Our deputy ministers, which are really permanent heads, I think they reacted a bit because the new deputy minister of Lean got to do some things, right? I made the title up, and apparently the political went for it. So that gave me an opportunity to nose into their areas. And when I say we've gone across government, I can tell you that the time to trial has been improved. If you want to drill a horizontal well, your licensure has improved. If you want to get a permit as a trucker to cross bridges in Saskatchewan, I can tell you that we can handle much more volume as a result. Your health cards are now, rather than waiting for days, months, your cards are literally delivered to you within the same week. We have taken improvement, unleashed potential, and saw great gains. At the same time, we reduced our workforce by 15%. That was not part of our Lean initiative, but I can tell you that that was part of the urgency around the kinds of improvements that were necessary to be able to manage what we had with fewer people.
Recently, deputy ministers from across government gathered at the T.C. Douglas building for a wall walk with the Ministry of Health. Dan Florizone, the Deputy Minister of Health, and his senior leadership team led the deputies on a tour of the ministry's success with Lean.
Well, it really helps us focus all of our resources, so both financial and human resources, on the few key things that we want to achieve as a system. So it's not our typical kind of incremental improvement. We want to have a revolutionary change. The point of the wall walk is to see how we're progressing on those breakthrough things.
The Lean Wall is where staff can find information about various Lean projects and their goals in a high-profile location for people across the ministry. Organizers of the Deputies Wall Walk got a lot of positive feedback from participants.
I think it's been a big success. Some of the comments we've heard from leaders is that they now have a better sense of the big picture and how their work contributes to our provincial success.
The Ministry of Justice is one of the teams inspired by the walk.
The Wall Walk made it real for me. In the next few weeks, the entire executive team from Justice is going to wander over to the Ministry of Health, and we're going to do our own Wall Walk. And then we're going to consider whether or not we need to employ Hoshin Cannery in rolling out some of our initiatives, our policy deployment, and we're going to see how we connect that with the lean initiatives that we have going on right now.
The journey that we've been on, you can see that there's a bit of a temporal aspect to it. I've had this great privilege of being involved in every step, from the original pilot, where I was a CEO of a health region, through to bringing it into a ministry, across a system, and then across government. We are new at this, and it is a grand experiment. I'm not sure how it will play out, but I can tell you that right now we've got proof of concept, both context and the approach. We've actually stolen many of the ideas out of the UK and other places. You mentioned, or you heard mentioned, an approach we called Releasing Time to Care. That's actually the Productive series out of the UK. Our difficulty with it was lean light, but it was a great introduction of our health system into lean. The beauty of the framing of it, Releasing Time to Care, is it resonated with those in the health sector. So we're looking right now at different approaches within education, and we're thinking maybe the way to frame it is releasing time to teach. You know, as a teacher, what are the barriers? What's in your way? So why go government-wide? Why do that? You know, it feels maybe a bit like flavor of the month, but the real privilege of going government-wide is some of the significant societal issues that we can tackle through this approach. And I want to share a few of them with you. So first of all, health, and we modeled the approach within the health sector. We set through Hoshin Cannery cascading priorities. We knew that, and in fact, we went through into our health sector and started counting up the priorities, and we stopped counting at about 200. Classic, right? So you count through these priorities and you think, well, if everything's a priority, nothing's a priority. We focus the system on 2 or 3 areas. And to be able to take a system, 43,000 people, and bring it focus meant a couple things. One is we weren't distracted by the many priorities, but fundamentally, we made visible those priorities. And we also recognized, in the spirit of respect for people, that their number one job is caring, not our next new initiative. So to do their work, if you're a teacher, your fundamental job is to teach. If you're a nurse, your fundamental job is to care, to provide service. What we were finding is all of our best initiatives coming from the bureaucracy, from those corporate rooms, all well-intentioned, was distracting us from job one. Think and act as one has been our mantra. So while we have separate units and separate organizations, my aha was watching 737s being built, Boeing, the Boeing plant in Seattle. And before we brought the CEOs of the health sector to Boeing, I think what happened was people were nodding from a leadership perspective. We think we want this, but until they saw it, they didn't really understand it. And what we're really doing is knitting together a supply chain of services. So within the health sector, that's one level. But within the public sector, that's where the real beauty is. So to think and act as one is our mantra in terms of government now. What is our common client, our common customer? And how are we doing in terms of serving them? We have silos for a reason. We've become highly specialized and highly skilled, and there's no way that we'll destroy those silos. But how do we work horizontally? to be able to engage those across sectors, to be able to truly look at the value stream from beginning to end. Part of it, through Hoshin Kanri, has allowed us to have the right conversations. And I can tell you right now, this is new, and we're still deploying. We have, through our health system, Dan was actually, when he was in Saskatchewan, we went to a hospital. It happened to be a hospital that was close by. And I took a bit of a risk because I said to Dan, okay, we're standing in the center of the hospital. I said, point in a direction and we'll go take a look at their wall. I had no idea, because I had never been to the floors in this particular hospital, to know that their wall was established. I only knew that they had been working on this. So he pointed randomly, and we walked that direction. I didn't even know where it was, but we went there. Remember this, Dan? And we actually saw their wall. We talked to a few of the staff. Every morning they have a huddle around that wall, and they not only talk about the direction and where we're headed, but they talk about their infection rate, they talk about the falls on that unit, medication errors. They know that safety is paramount, and they're talking about it every day. From meetings to 10-minute huddles. And those huddles have created the kind of daily work, daily improvement. We're now working government-wide, and in fact, we just did this within my office. We've got idea boards that are now being instituted to unleash not only 40,000 people, but hundreds of thousands of people in terms of the ideas that they generate. Our satisfaction surveys right now within my ministry that I'm responsible for, we used to do them yearly. And by the time you got the answers, you couldn't even remember what the questions were. Now we do them weekly. 4 questions, Survey Monkey. I can tell you exactly, as of today, what my staff were thinking last week. Is that ideal? No. I'd like to know today what they're thinking today. We're working towards the mechanisms and the approaches that are in the spirit of the internet. Real time. No, it's not research. It's more of a dipstick check. How's the oil doing, right? Checking the dipstick every day to understand how our people are doing, how our customers are doing, and how we're doing in terms of serving them. The cascade, we've got to be really careful in the context of government here. Last thing we want is more bureaucracy, right? Infrastructure has been important. So we've got Kaizen promotion offices that have been set up. And this is a bit of fodder for the political. You know, people are questioning the use of Japanese terms, the use of lean and Kaizen and the work that's going on. It seems like we've set ourselves up for a pretty good debate in the province. We're building the capacity, and part of it is training. And I got to tell you that, you know, we kind of go to what you can measure, but unfortunately, sometimes what you measure is not the most important stuff. I just want to show you, here are some of the healthcare improvements that we've seen just in the last 2 years. Look at those percentages. Lead time, 55% reduction. Quality defect reduced, 71%. Our target's always 0. Space, 31.1. Storage, 33%. Inventory, 53%. We're talking about a $5 billion system in health. Maybe small potatoes in terms of us in Saskatchewan, a relatively small jurisdiction. But what we've got is, in terms of proof of concept, is if you focus on the customer, focus on the patient, focus on the client, there are huge dividends in terms of waste reduction and value creation. Not even that is the most important piece here. I want to show you what the most important piece is, and then I'll... There's another presentation here, but I just want to show you something. This isn't lean, but I can tell you it's the same underpinning lean thinking. What you don't see here with these dots is there's a map of a city in Saskatchewan. And I took it away, took it out of this presentation only because it's identifiable. Those dots are a street address. So if you had the map, you'd overlay those dots. So what we did was we started with the number of grade 1 students. So these are 5 and 6-year-olds that have missed school more than 80% of the time in this particular city. And we took them right to their street address. And then my colleague in policing took a look at those same street addresses that had 5 or more police calls. Also 1 call. And we overlaid it and the map lit up. It lit up, and what we realized and recognized, and we knew for some time, is that the reason our children weren't attending school was much greater than just not waking up in the morning to be there. Their families and their issues and the societal underpinning of why they weren't in school, they were encountering other services. And these are just 2 services, education and policing. If we were to take a look, and we're working on this, of integrating our ER visits, if we're going to, and we're working on this, take a look at our social services recipients, you'd find that these same children and their families are recipients of a whole host of government services. Now take that value stream and start breaking it down. And what you'll find is that we are doing a very insufficient job of caring for and supporting the most vulnerable of our students, of our children. So right now, the state of Texas looks at grade 3 reading, literacy, and decides how many jails they're going to build based on who's not reading at grade level. We have a target under Hoshin-Kanri that each and every student will achieve grade level reading. Now, you look at that and you say, how is that possible? The fact is, it speaks right here to the heart. And we know that the best predictor of your future, your graduation, your employment, even your health, is by providing the supports that are necessary to be able to, from grade 0 to 3, learn to read. Because after grade 3, you read to learn. These value streams are fundamental to our work. That's why we're doing what we're doing. So talk about lean, talk about the value streams, talk about the improvement, talk about engagement. All of that is great, but fundamentally what we're here to do is put the citizen first. With that, thank you very much for this opportunity to speak.